Hi, it's Julien Barker from Chiropractic. Sorry I've missed a few weeks. I've been very busy. We've been extending, doing building work in the clinic, and it's been really busy. I'm here with Kathy. Kathy's lower back is all sorted out. We did have a car crash a few weeks ago. That's all settled down nicely now. She's telling me she's got some spasms up between her shoulder blades, some spasms through the mid-thoracics, and just keeping an eye on her right knee, which is all to do with dancing, isn't it, and Zumba. Yeah, indeed. Okay. Good, nice and steady. Best knee up first. I'll put the left one up first. There you go, hold on. Last time I adjusted Kathy, actually wasn't too much going on. I've been just checking, keep an eye on this. There's been a recurrence of an L5 facet, so just keeping an eye on that, which is definitely to do with impact during car accidents. Road traffic collisions, as I believe they are called politically now. Road traffic collision, because RTA, accident, implies blame. Okay, absolutely spot on level in position 1 and position 2. Know from history that Kathy's usually left PD. So we can go straight to position 3. So squeeze your knees together and let go. So first testing is basically PS, and there we go. Okay, there's a couple of ways of adjusting PS. So I'm going to come on to the left side, and I'm aiming through the front bone of the pelvic arch. There. So the angle is important. Basically aiming at the disc at the front. Worth retesting. So squeeze knees together, and there you go. Okay. I'll run through the rest of the essential scan. That almost certainly means there's something going on the right knee, and usually it'd be a shear that either gracilis or sartorius is involved in. So we'll come back to that in a minute. So left hand up behind your back, and swap your hands. Both hands up behind your back together, both back down by sides. Take your left hand up by your face. Big deep breath in. And now, right hand up as well, both back down by sides. Turn your head to the left, lift the left shoulder up off the couch and back down. Shrug both shoulders up towards your ears and back down. Squeeze the left elbow flat against your side and let go. Squeeze the right one in and let go. Shrug your shoulders up and roll them back, up and roll them down. Good, head back into the centre. Lift up your head, back down. Tuck your chin down to your chest, back to centre. Okay, push face into the couch and let go. And the QL test, stretch left hand to left knee and let go. There we go, right hand to right knee, and let go. So what's the difference between the basic scan and the essential scan? Well, the essential scan has the QL in it because it just comes up so often. Very tempting to start getting all fancy and not run through the essential scan, basic scan, to start going for all the other interesting things straight away. Almost always a mistake. I would say run through the basic or essential scan will clear so much most of the time, and if you're finding a lot, you probably shouldn't be doing much more anyway. So the one I wanted to check was the L5 facet. So left hand up behind your back, so standard L5 isolation test, and then flick. Got a couple of choices. You can do both, you can do one either side. It's a lateral test if you find anything it's specific to that test. Swap your hands around. We just go up a level, L4, just to be double sure. Okay, that's good, and back down. And the other one is anterior inferior sacrum, anterior sacral base, same thing. Lift both hips up off the couch together and back down. Yeah, we did have that the other week. It's clear. It's cleared now. Okay. I just want to check the knee, and then. So this is looking at a shear. There you go. Yeah. So when I'm pushing tibia lateral femur medial, that one there, yeah, sensitive, isn't it? Yeah, definitely setting it off. So the adjustment is to go the opposite. So I'm adjusting on laterally on the tibia and medially on, sorry, lateral on the femur and medial on the tibia. So right on the base there, definitely into the tendon of gracilis and the adductors, and going through the base of the tibial plateau into tibialis anterior. Okay. So, the thing that Kathy was talking about. So, mid-thoracics, anyone talks about that and you don't find anything on the basic scan, often it will be either T4 or T6. 7, 5, 3, 2 are worth checking. Beyond that, maybe ribs, you don't find anything, leave it well alone, it'll sort itself out. Okay, so let's turn your head to the left, take your right hand up above your head. The other right hand. There you go. Caught on camera. There you go, look at that. T5. Arm back down by side, head back into the centre. If there's anyone that T5, the rib can be sore. So come across finding 3 and 4. T5 is quite high up, and I just find with experience, you know where it's. I'm definitely on it here, aren't I? Yep. You feeling this? Yeah. Going straight across onto the rib, and it's usually the rib that is the sore bit. Yeah, and that feels like it's wooden. In the nicest possible way. Yeah, clearly tender. Felt good to me. Just for the camera retest. So turn your head to the left. Put your right hand up above your head. There we go. Arm back down by side. Excellent. Head back into the centre. Let's see how Kathy gets on with that. And great. I shall see you next time.